Hello and welcome to Care and Wellness Connection. Care, wellness, and empowerment. Conversations with Nene and Ion Care. I'm a nurse, Nene, a coach, and founder of Ion Care and Undroma Wellness. This month we're talking about something powerful, simple, and deeply human. Storytelling. Not social media storytelling, not marketing storytelling. I mean real stories from care. Stories from families, stories from nurses, stories from caregivers. Because stories don't just inform us, stories transform how we see care. Let me start with a simple truth. People rarely remember statistics, but they remember stories. In Nigeria, when families first contact Aeon Care, they often say, "We didn't realize our mother needed help until something happened." And that something is usually a story, a fall, a moment of confusion, a missed medication. In the UK, when I coach healthcare staff through Ndoma Wellness, the breakthrough moment rarely comes from a policy. It comes when someone finally says, "Let me tell you what really happened on that shift." Stories reveal truth. And when leaders listen to those stories, culture begins to change. A caregiver story from Nigeria. Now, let me tell you about Chinedu in Lagos. Chinedu lived abroad for years. His mother lived alone in Nigeria. She insisted she was fine. Every phone call sounded the same. "I'm okay." Then one day a neighbor called. She had fallen. Nothing serious, but enough to scare the family. When we spoke to Chinedu said something powerful. We kept asking if she was okay. We never asked what her day was like. That changed everything. Because when they started asking different questions, a different story emerged. She was lonely. She struggled with cooking. She sometimes forgot medications. Stories reveal the reality behind politic or polite answers. That's why professional elder care is not just a service, it is support for the real story families are living. Storytelling in healthcare leadership. Now, let's bring this to healthcare leadership. Many leaders rely on reports, but staff respond to stories. When a nurse leader shares a real experience from practice, something powerful happens. People feel seen, they feel understood, and suddenly leadership feels human. This is why storytelling is such a powerful coaching tool. In nurse coach sessions, I often ask nurses, "Tell me the story of when you felt more confident at work." Not their CV, not their job description, but their story. Because inside that story are clues about confidence, resilience, and leadership potential. Sometimes people already have the leadership story, they just haven't recognized it yet. Three ways to use storytelling in care. Let's make this practical. Here are three simple ways storytelling strengthens care and leadership. Number one, ask story questions. So instead of asking, "Are you okay?" why don't you ask, "What was the hardest part of your day today?" That invites a story. Stories reveals what's really happening, what really happened. Number two, share learning stories. Leaders should not only share success stories, share lessons, share mistakes, share growth moments, because this builds trust and psychological safety in teams. We all know about this. Number three, reflect on your own care story. Every caregiver has a story. Every nurse has a story. Every family navigating elder care has a story. When we reflect on those stories, we learn. Reflection turns experience into leadership. Now, why storytelling matters for the future of care. For Aeon Care, storytelling is how we change the conversation about elderly care in Nigeria. We move from families should cope alone to families deserve support. For Undoma, storytelling helps organizations understand the real experience of healthcare staff. And for my coaching clients, storytelling helps nurses see their careers differently. Your story is not just your past. Your story is your leadership foundation. As a nurse, I once believed leadership meant having all the answers. As a coach, I realized something different. Leadership means creating space for stories. When people feel safe to tell their story, the team grows stronger, care improves, and communities become healthier. So, this week, try something simple. Ask someone in your life, "Tell me about a moment in your work that stayed with you." Listen to the story. You might learn something powerful. If this episode resonates with you, share it with a caregiver, a nurse, or healthcare leader, and join the conversation using the following hashtags: Care for Caregivers, Storytelling Care, Aeon Care, or Undoma Wellness. You can also download caregivers resources on www.eoncare.com and look out for the resources and guidance. Thank you for listening to the Care and Wellness Connection, where we believe care is not just a responsibility, care is a story of compassion, dignity, and leadership. Stay healthy, stay informed. Thank you, and see you next time.